you've mentioned women several times. Is this something that, guys do we not have to worry about pelvic floor or core training? Hello again, it's Dr. G with Healthy Exchanges with Dr. G. And this is our newest episode of our brand new podcast featuring myself and the excellent professionals that I meet along the way as we build this practice in Hollywood, Florida. Just a reminder of who I am, an internist by trade, by training in Hollywood, Florida, born and raised down here in Hollywood, and took a roundabout trip around the world to Mexico, Ponce, Puerto Rico for training, and right back home to right here in Hollywood. A little bit closer to my high school, actually, right around the corner. As we built this practice, I realized there's a big problem here. There's a disconnect between what we're doing in healthcare and the information and the services that we're connecting our patients to. They just don't know about them, or we just don't make enough effort to put together to get our patients together with our services. And that's why we have this Healthy Exchanges with Dr. G. We have conversations with great professionals in the South Florida area. And my mission is to make it as much as possible to get our patients together with the information and grow a healthier society down here in South Florida. Today, we have a very special guest. Her name is Joselyn Rodriguez, and she is a physical therapist with a core training. Her core is in core training and pelvic floor training. Her company's name is J. Interesting name. I think we're going to find out why she decided to call her company J. So without further ado, let's go ahead and get to our guest, Ms. Joselyn.
Thank you so much for having me. What an introduction.
We try. We have so much material to work with
yes.
you, thankfully.
Let's chat.
Absolutely. Jay, why don't you tell the people who you are and where you're from?
Sure. So my name is Joselyn Rodriguez. I am a pelvic floor physical therapist. I'm originally from Brooklyn, New York. And then I went to school at the University of Michigan, where I studied athletic training. Worked on different sports teams, and then decided to go back into school to get my doctorate in physical therapy. And during that time, I became pregnant, and along the way, I realized that pelvic floor care is an integral part of women's health that isn't being serviced, and that's why I do what I do.
Wow. You forgot to say the newly crowned national champions.
Go blue, go blue.
Congratulations.
Thank you.
Congratulations.
It's been a few decades, but I'm happy to be there again.
Overdue
Yes.
For sure. So tell us a little bit more about your business. How did you come up with the name of your business? It's unique. So where does that come from?
Thank you. So a lot of people think that it's because of my first name, Joselyn, but it's J-A-E, and that's actually for my daughter's middle name, which is the reason why I kind of stumbled upon pelvic floor therapy.
Nice. It sounds like pelvic floor therapy came for you in the form of the birth of your daughter.
Yes.
And it also sounds like, obviously she is your why. I mean,
yes.
Yeah.
So she is my why. She catapulted me into this profession. And I was lucky enough to be in a large organization that had pelvic floor therapists, which allowed for mentorship and assistance in, getting my footing in the specialty.
Great. So how long have you been in the community doing what you do here in the South Florida community?
I have been a pelvic floor therapist now for 3 years.
3 years.
3.5 years, yeah.
Nice.
Yeah.
Is it something that you could see yourself continuing to do for the long term?
Yes.
Absolutely.
This is my profession. Pelvic floor therapy isn't going anywhere.
Mm-hmm.
And, at the rate that people are having pelvic floor dysfunction, it's essential. There aren't enough pelvic floor therapists in South Florida to meet the need. We are always encouraging students to consider pelvic floor specialty. And, pretty much I'm a clinical instructor as well. And pretty much any student that comes through me is learning something about the pelvic floor, whether they wanted to or not.
Good, good. I mean, if you're a specialist as you are, that's something that you should impart on your students to understand the need and the necessity to attack these areas of need in the community, in the specific patient that they're dealing with. So that's great that you give them a little piece of knowledge. Maybe you'll inspire the next pelvic floor or core trainer along the way as well.
Right. So the need for pelvic floor care occurs at multiple aspects of someone's life, but most commonly it happens to women, and it happens prenatally. It happens the postpartum, and it happens at menopause as well.
Right. You've mentioned women several times. Is this something that, guys do we not have to worry about pelvic floor or core training?
Anyone that has a pelvis, anyone who can control, or anyone that needs to use the restroom, traditionally has a pelvic floor, and they can at some point need the care. And so that means men, that means children. A lot of children have constipation, which affects bedwetting. It causes bedwetting and things like that. So if you have a pelvis, there is the likelihood that you will at some point need pelvic floor therapy at some point in your life.
Understandable. So what I'm hearing from you is that there's pretty much not a patient that you wouldn't be able to help in some way, shape, form, or fashion if they have issues with the pelvic floor.
Right.
Be they men, women, older, younger, children, it doesn't really matter.
Yeah.
What about patients who have made transitions in their gender?
Yes. So people have had gender affirming procedures, especially at the pelvis. That's something that a pelvic floor physical therapist can help with, especially if they've gone from male to female, because that can cause changes. There's soft tissue restrictions that can happen that, if not initiated, the treatment is initiated essentially immediately, that can cause some difficulties in the future.
This is very interesting to me because one of the things that I meet on a daily basis from my patients, so one of the issues that they have is urinary incontinence. It's typically a middle-aged to older female, and it's a it's a common complaint.
Yes.
And us medical or internists, we're very limited as far as what we can do. We work with medications, we work with lifestyle changes. So my approach to almost everything is to change lifestyle, but I can't really think of anything outside of telling the patients to train and get up and go to the restroom a little bit, on a certain time frame that I could offer them. So what you offer them is actually therapeutic.
Right. So there are some things that you can do. I think it's a great idea to do like a training schedule for them, but maybe like a toileting diary so that they can see what they're inputting to their body, what's coming out, at the times that it's coming out on. So that's some of the things that we do. But a lot of it, sometimes like with urinary urgency, it's all behavioral. It's not that they actually have to go. It's just they've changed their bladder neurologically that they need to go more often. They don't actually need to go. So it's all just behavioral changes, in regards to that. But urinary incontinence, like you said, does affect a lot of women, but it does affect men, especially post-prostatectomies. And that's a common complaint. And what I've seen with these situations, in a lot of situations, in my experience, these men are getting significantly better in 3 to 4 visits. It's really drastic, the changes in their quality of life, skin and tissue integrity, the cost of diapers. They are very happy with receiving this short care.
Nice. And that's game changing. I mean, 2 to 3 visits and you're already seeing improvements. There's not a lot of medications I can say that for any condition that I can say, you take the pill 2 or 3 times, or do this 2 or 3 times, and then all of a sudden you're feeling a lot better.
And here's why it works: is because a lot of what we do as pelvic floor therapists is improving body awareness. Some of these people have disassociate from their bodies. They don't know, maybe because of past traumas or recent traumas, surgeries, and they're just not connected anymore. And we help them make that connection with simple things like breathing, contracting, feeling, exercise, and just getting them reacquainted with their bodies and making sure that they're doing things correctly. A lot of times people are not using their core correctly, and that's affecting their pelvic floor. It could be as simple as that.
Nice.
Yeah.
Nice. Your insight on exactly how, how this mechanism happens is invaluable. This is not something that, us physicians of, any kind, maybe outside of urologists, possibly have this type of, this knowledge.
Right.
But in my experience with us doctors, it's the time factor, right? For especially those who practice the traditional type of insurance-based care. We do that here as well, but we also have our concierge practice where I would be able to get this information out of the patient and know that there's an actual problem outside of, what we usually say, oh, well, it's a prostate, or you just had too many babies, and then this is what it is, deal with it, right? But honestly, just meeting you and knowing what you do and knowing that this is a therapeutic option, I think this is like number one. This is even before I even hit the prescription pad,
Well,
should be setting you
there are
your way.
even a few diagnoses like painful bladder syndrome, where the only form of treatment that has evidence results is, or data is pelvic floor physical therapy. But a lot of people are still not being sent in the right direction.
Right. Yeah, that's a common issue. When we don't know the therapeutics for a certain issue, we just underdiagnose it. Because it's one of those things that doctors don't like to feel inept when they come across a problem. It's like, well, I'm just going to act like I don't see it. So, I'm not saying we do, but it's kind of hard to tell a patient, we have this or that for you if we don't, we're not looking for it. Right? We don't know, we don't have anything for you after that. So it's just a human nature type thing. And that's something that I avoid. I avoid not giving options if I don't know the answer. What I do like to do is refer. I will refer to someone who is a specialist in pelvic floor when I see a pelvic floor issue, and other issues.
So what other types of specialties do you refer for?
Well, typically for gentlemen and women for in urinary incontinence, it's typically, first thing I do is check to see if there's a UTI, ask about their habits, how much water they're drinking, when is this happening, and if it's not, any one of those things that I can tell, those patients do get, a urology consult, referral, and most times they come back and there's really not a good answer, right? The guys get the urology workup for prostates, and the women typically get, not much. To be honest with you, there's not much medication. Uropexy is one of them, just to lifting the pelvic floor. I don't want to use crazy terms that the audience doesn't know, but basically it's like a basket, a basket holding up the bladder, the floor, and 50-50, I would say. I would say
some of the studies show that they, some certain types of those prolapse surgeries can, after like 6 years, can actually, fail. So, but that's not to say that they don't feel better.
They may feel better.
They may feel better. So, but a lot of the research shows that pelvic floor therapy for, the lower grade prolapses can be very helpful, because it's all about pressure management, managing the pressure correctly. Like the amount of people that I see that don't know how to poop correctly is like mind blowing, because you don't know you're not doing it right because nobody's taught you. Nobody's taught anybody. You potty train, when you're 3-4, and it's like, hope for the best.
We don't really get good training. We just say when we're just don't do it in your pants.
Just don't do it in the pants, or on the floor, or in the corner.
As long as we can get the kid to go to the toilet, we're okay. We're okay. So tell me, your mission for your business. What would you like to see your business do in the community in 2024?
So this year specifically, I would like just to be, meet more people and just educate more people. I think something like this is amazing because we can reach a lot more of an audience, and just really explain the role of what the pelvic floor is, and how to know that it's not working correctly and when to see a specialist. And so a lot of people, they, like you said, they go to a physician, they get cleared, but their symptoms aren't really addressed. And so I think that's a perfect time to see a pelvic floor therapist, because the pelvic floor a physical therapist is the expert on muscle, the expert in movement. So we're the ones that can really assess, you know, do you have the strength? Do you have the coordination of, do you have the power? Do you have the endurance of these small muscles? And so that's what I do. Essentially, the reason why I can do what I do is because it's muscles.
Right, right.
Yeah.
What would you say? What would you say is your biggest challenge with that you've met in the last in your career, as far as helping a patient get along and get, you know, improve their symptoms from, you know, pelvic floor issues?
I would say stigma.
Okay.
The topic being taboo. It's just that pelvis is a very, you know, it's an area that's just very personal, can be very traumatic for people. And it's important that any pelvic floor therapist has a very trauma-informed way of treating the patient, because they're not going to be forthright initially and say, you know, I have a history of blah, 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 abuse or whatever it is. And so we have to tread very, very lightly, and just, I pretty much treat anyone that they have the possibility of having some form of trauma, where they get, you know, I ask them for consent, written consent, they get verbal consent. I tell them every step, everything I'm doing, so that they're aware, and I'm asking for verbal okay every time.
Right.
So that they know that they have complete control of what's going on in the room.
100%.
And if they can't see me, I'm giving them a play-by-play of what's going on, so
Right.
that they can trust me. And so that hopefully maybe not the first visit, but maybe the fourth visit, they tell me something. And then maybe we have to then include a mental health specialist or some other specialist to help them through that. Because sometimes there are some diagnoses that will not improve unless the mental health aspect has been addressed.
Right, right. Where would you say the most your best referral? Like, where do you get most of your patients from? Is it from an internist? Is it from the urologist? Is it from a surgeon? Where do you get most of your patients to come to you?
Usually GI for constipation, or an OB-GYN.
Okay, yeah, that makes sense.
Yeah. And then, of course, the urologist for prostatectomies. Pretty much any man who's had a prostatectomy should see a pelvic floor therapist for the urinary incontinence, for erectile dysfunction, for any symptoms they may be having.
Cool.
Yeah.
It's interesting that you don't say the internist. That's interesting. And I don't think that's because we don't want to refer to you. I'm going to be honest with you. Before I met you, didn't know the subspecialty in physical therapy existed. Now that I know that, you know, I'm definitely going to put you in my tool belt, you know, in your name, in my Batman tool belt. So that way, when I come across this, you're actually number one or second call for sure for this issue, because I am not the type of doctor that likes to, you know, try medications first. If I could, for every single thing that I see that's pathology or pathophysiology, I like to throw lifestyle modifications and changes, and I consider what you do part of, you know, lifestyle changes and strengthening the core. So I mean, I'm going to start telling people about, you know, pelvic floor trainers and therapists like yourself, because I think you're invaluable. We see it a lot. We see it a lot. It's not because, just trust me, these people that you're getting from the urologist and the GI or in the OB-GYN, they're coming from us. Like, we're trying to find an answer.
Right.
But yeah, if we can circumvent that, one, I think it'll cut down on patient frustration, improve patient satisfaction. It'll also decrease costs on the healthcare system in general. So yeah, definitely
improve their quality of life.
Improve quality of life. So
how many moms are told, oh, it's normal.
Exactly.
Live with it. This is the cost of deciding to have your children.
Wow.
You know? Or how many people are told, have a glass of wine, you need to relax.
Sounds very bad. Sounds bad. Doesn't sound very empathetic, right? Especially if there is a viable, you know, non-medical option.
Yeah. I mean, I've had patients who post-pregnancy and delivery have had like significant pain with intercourse, really wanted to have another child, but couldn't enjoy and get, you know, enough time together to make that happen. You know, a few visits, she's pregnant. You know, and so this is something that has a huge implication for, you know, people's, you know, family goals as well.
Right. I mean, one of the things that I'm not tooting my horn or anything, but it's just something I'm good at when the door closes in the room, in the exam room, is getting the patient to get comfortable with me as quick as possible, like pretty quick.
Super important. Yeah.
I wouldn't say not everyone is super ready to divulge all the deepest, darkest secrets on the first visit.
Right.
But by the second visit, I am, I'm good at getting some of this, information out. You've touched on a little bit about being careful about, pushing patients along because we're not sure exactly where their urinary incontinence comes from. What would you say is your, I'm not going to say tactic, but what is your technique as far as getting some of this information out that's, from a very sensitive place? What's your approach to getting this information from people about sensitive subjects like this?
So a visit with me is 55 minutes to an hour.
Nice.
So that helps, right?
Mm-hmm.
But before I even am meeting with the person in my office, we do a 50-minute, I prefer a video call or it could be a phone call.
Mm-hmm.
But that gives an opportunity to ask me questions, see my face, get to know me, start to instill that trust, and the first 20 to 30 minutes of the visit is literally just talking.
Right.
It's talking about when do your symptoms come on? When did it start? How often is it happening? All those really specific things that are going to really give me an idea of, is this an endurance issue? Is this a behavioral issue? And then that kind of helps me focus my exam.
Okay.
Right. And my exam isn't just the pelvic floor. I'm not going straight for the pelvic floor internal assessment, right? I'm assessing the lumbar spine. I'm assessing posture, balance, functional movement like a squat. So I'm also an orthopedic certified specialist. Like I took a second board. That's like my bread and butter. And that helps me, I think, be a better pelvic floor therapist because I can look outside the pelvis for causes for people's symptoms like their feet, like their jaw, like TMJ pain and dysfunction. And because some studies have shown some indications that, pelvic floor dysfunction and TMJ are, very closely related just because of how people tend to, take on stress on their bodies, So I just, I'm busy educating them, telling them exactly what's going to be next, and hopefully things come up. But a direct question I ask is there any history of trauma I should know about? Right. Emotional, physical, sexual, births, any surgeries, because those can be traumatic as well.
100%, yeah. I mean, we have to be sensitive as medical professionals as to how we broach these subjects. And we have to be, we have to have empathy. And here in my office, that's one of the things that I demand from my staff. And thankfully, we hire well. So everybody is, my staff are keenly aware to, people and how we approach them and speak to them. Because it's important, right? One of the things we want to make sure is that for every time they touch us or we touch them, as far as virtually or when we have a dialogue, that we make it a respectful dialogue and that they want to come back.
Yeah.
So I can see how what you do is even more sensitive, seeing how where the issue is, it can be an intimate area. So yeah, your approach is very important, and that's something that obviously doctors. That's another reason why we get to urology and then it ends up to you. Some doctors just don't feel comfortable, or don't get that comfortable with their patients. So that's good that you It's great.
I mean, I've had a few med students that I'm seeing who have said, based on how you treated me, I've changed the way I work with my patients. Like I've tried the tactics you tried with me to get me comfortable, and it's really made a difference. So
of course,
and I love that ability to help someone else in their practice.
Right. They try to teach us these things in these modules in medical school. It fails miserably, I'm be honest with you. There's not a book on it or any type of real one-to-one teaching. It's interpersonal skills, and we just have to figure it out. But it's not like something. It's a skill. It's a skill that needs to be practiced, and I love to hear that if I were to send a patient to you, which definitely will in the future, that I know that they're going to be taken care of, and
most of the MDs have figured it out. Most of y'all have figured it out.
Figured what out?
Interpersonal skills.
I guess. Maybe I'm one of them. I hope so. Do you have any other questions for me? I'm just firing questions at you left and right.
How does someone like get situated in your office? Like, do they call? Is there a website?
Well, we have many ways that you can get in contact with us. We are really active on Instagram.
Okay.
We have two different websites one for our internal medicine and our concierge practice, and we have a different presence for our what's called office-based aesthetic procedures and body sculpting and things like that. So very clean look. It's all medicine on one, and the other one is aesthetics. We have this our YouTube presence as well, and all of those have our information to reach out to me. So
awesome.
yeah, we make ourselves very, very open as far as speaking to patients. I've had patients DM me, and we go back and forth there. So call, of course, and call the phone number, which will be in the description. Right back at you. How do patients get to you if they don't come straight from me? I missed the diagnosis altogether, and they're seeing this podcast. How would they reach out to you?
So my website, which will hopefully be in the description.
Yep.
My Instagram, they can DM me as well.
Yep.
And then they can also book the free phone consultation or free video consultation.
Great.
Where we kind of dive deeper and see if it's an appropriate, time to see them, right? Because sometimes maybe it's right post-op or something like that, and it's not appropriate. Or if I'm like, you know what, that's a red flag. You should make sure you talk to your physician about this first before you come see me. Yeah.
Cool. So many ways as well to get to you, so that way nothing gets missed here.
Yeah.
I have one last question for you.
Yes.
One of my favorite questions that I think you guys are going to pick this up. But where would you like to see your business, your business, what you cause here in the community with Jay? Where would you like to see that 10 years after you are gone?
So my vision is that Jay Physical Therapy has become a point of education and has provided the knowledge to both providers and the community that this is a great form of treatment, that this is not the last line of treatment, that this should be considered before surgical intervention, not just to avoid it, but maybe to make the surgery more successful as well. And just so that every prenatal and postpartum mom gets at least one pelvic floor visit. Prenatally and postpartum. This is something that is automatic in countries like France, but just hasn't been the norm here just yet.
Wow. So what I'm hearing from you is that you would like to make this a universal treatment, standard of care, basically.
Standard of care.
Make it standard of care, especially for certain situations, but higher level of recognition, a higher rate of recognition of the condition, and make this part of the decision making for surgery or not, or an adjunct to surgery.
Right. Absolutely.
Right.
And in the state of Florida, physical therapy is open access. So I can see someone without a prescription for physical therapy. We can assess, is this really something that you should be seeing me for, or should you be going to see a physician for?
That is a great piece of information. Now that is gold, what you just said. The fact that open access means that you can walk, you can self-refer, you can see a physical therapist like Joselyn and get a diagnosis or an evaluation, and possibly get
the care you need.
Get the care you need without the need
and not having to, wait to be able to see a physician. Unfortunately, sometimes seeing a physician can take a long time, and that limits your improvement.
Tell me about it. Taking this physician sees. That's why I made this practice the way I did. That's why I have the concierge level service that we have for those who need more, more touch points with the doctor, maybe more visits, maybe a longer appointment times. Like you offer 55 minutes, I have that 45 to 55 minute, appointment.
That's amazing.
For concierge patients. We talk about everything. We get deep. We dive deep, and I get to know them very well. So, is that something that you also provide? I know you said 45, 55 minutes, but you do insurance and then you do cash pay. Is that correct?
So
or
I'm
no
an
insurance?
Out-of-network provider.
Completely. Okay.
So that means that if someone wants to come see me with their insurance, then they have to make sure that they have out-of-network benefits.
Okay.
That then they would be reimbursed by their insurance carrier. And so before I even start treating them,
Right.
I send them that sheet that explains what that means
Mm-hmm.
and gives them some questions to ask their insurance to make sure that they completely understand what is their responsibility.
Yeah, what their cost would be.
Yeah.
So that's actually a help, to be honest with you, because sometimes, as you know, insurance does get in the way, which is why I have the concierge side of my business.
Right.
So that's good to know. So patients, can get whatever they need, and you are making it crystal clear as to what the expectations are and what their processes are if they do want to go through the insurance but out of network.
Right.
So that's amazing as well.
Yeah.
Did you always know that you wanted to be a physical therapist? Is it something that grew on you? I know it happened. You during childbirth and afterwards you had your issues, in which makes, I guess, turn the light on. But was there something in the back of your mind before that to say, hey, you know what, this is what I want to do?
I think that it wasn't until I became an athletic trainer that I really wanted it, that I decided that I was most likely to go back to school for something. I wasn't sure if it was PT or PA, physical therapist or physician assistant. But then I decided that I didn't want to do physician assistant for the same reason I didn't want to do athletic training, which was autonomy as a provider.
Right.
Because as an athletic trainer in the state of Florida, you have to work under a physician. The same thing with a physician assistant.
Right.
So then I decided to do physical therapy.
What I'm hearing there is I'm independent. And I want to do what I need to do
Not necessarily
when I want to do it.
I just don't want to be limited.
That's what I mean. That's independence, right?
I just don't want to be limited, you know?
Of course.
Yeah.
And I like that. I like that because that means that you are, you don't want to be, I don't want to use the word limited again, but you don't want to be boxed in to the point where you want to do the right thing and someone else's thinking or limitations also put limits on you. I 100% believe, I 100% understand that. I live in that world. I live in that world.
Right.
I fight my battles here all the time.
Yes.
So I get what you're talking about.
Yes.
Amazing. When I say I live in that world, I don't allow others to put limits on me.
Right.
Great. Speaking about limits, describe what a session is. What the type of exercise that you do, typical exercises that you would do with a patient.
This is a good question because some people might be like, you know what, I don't want to go and have an internal assessment. You don't have to have an internal assessment if that's not what you want yet. Maybe eventually you'll feel comfortable with me to have that done. But if you don't, that's fine. Because for some people, the treatment would be either vaginally or rectally, and they're just not okay with that. And I completely understand. So there are other ways to assess pelvic floor. I mean, I see people virtually, so clearly I can have a hands-off approach, right?
For sure.
So there are other ways to get an idea of what the pelvic floor is doing. You don't get, it's not 100%, it's not as good as an internal, but it can give you the first few steps to take. And a lot of people do see improvement with just internal assessments. So that could be you fully clothed and my hands like on your perineum, right? On the space between the openings, right? It could be you sitting on a chair and my hand, in your underwear with the glove, obviously, but me feeling for the tailbone to see what the tailbone is doing, right? Because the pelvic floor muscles attach to the tailbone.
Right.
So I asked you to contract. I should be feeling something happening to the tailbone. I asked you to relax. I should feel something else happening to the tailbone. Right. I asked you to bulge, like when you need to poop. I should feel something else happening to the tailbone, So there are different ways if you don't want the internal assessment. But checking the lumbar spine, checking the hips to make sure that the hips aren't involved because, there are some pelvic floor muscles that, work together very closely with the hip muscles. Sometimes we'll see people who have back pain who in actuality it's pelvic floor issues. So it's important to kind of, work and, get that differential diagnosis to see, what is actually going on.
What the real issue really is.
So the beginning of the visit is just like any other orthopedic visit for like your back.
Okay.
And then is the internal assessment if you choose to.
Assessment.
Yes.
Could you tell us a little bit more about how the core muscles tie into what you do, your therapy, and how it ties into pelvic floor?
Yes. So technically, the pelvic floor is part of the core.
Right.
So when you look at the core is the traditional, the abdominal muscles. It's also the back muscles. It's the diaphragm and it's the pelvic floor. So it creates kind of like this canister. The canister acts like a pressure management system. right? Think of like a Coke can. Coke can, before you open it, before you pop the top, it's really, really strong. And so that's increased pressure. You remove that pressure by opening the top, and then the walls cave in, right? And so with the walls caving in, the walls would be the muscles. So we have to make sure the muscles are really strong, that we're not just creating pressure. Because increased pressure can lead to diastasis recti, hernia, prolapse, incontinence. So
That's interesting. Because some people, well, most of us, when we think about pelvic floor, we don't understand that the rest of the muscles that go upwards in the core need to also be strengthened. So it makes sense.
Yeah.
So it makes
Yeah,
sense.
for sure. I mean, studies show that you have a stronger pelvic floor activation by doing like bridges, lunges, squats, more than just doing a Kegel, right? So my exercises aren't just you sitting there Kegling all day, right?
Wow.
If you're weak, it's me looking at the whole system and seeing do you have hip abduction on this side that then's making your left side pelvic floor having to work harder and fatigue earlier and all that. So we're just looking at the whole system. I'm looking at the whole system to figure out the puzzle.
That's amazing. That's amazing. I can't wait to take part of the core training that you're going to be doing for us on the 27th.
I'll be going over a lot of what I just said too.
Nice,
Yeah.
nice. So we will have Ms. Joselyn. She's going to come in and do a session for us, a core training session at one of our fitness boot camps, lifestyle changing boot camps here in 2024 for FCMW. And the description for that will be down below. But I don't know. It's gonna fill up pretty quickly.
I can't wait.
I'm sure it is. We've already got a couple. We haven't even started taking names yet for it, and people. I don't know how they heard. I guess I talk too much probably, and they're calling. So
I mean, for some of these people, if they happen to have incontinence, this might be the answer. Like what they learn at this event might completely, address the reason why they're having their incontinence.
That's amazing that you could, we could actually cure people without, surgery or medications, just with exercise. That's truly what what I preach here, that lifestyle modifications and stepping outside of the normal traditional things that we do may be, the way or, the most beneficial for each patient.
Especially in the long term, right?
For sure.
In the long term.
Everyone's different.
You don't want people to be on medications forever.
Absolutely not.
Sometimes it's necessary, but hopefully not forever.
Absolutely not. So I really enjoyed getting to know a lot more about what you do. I'm looking forward to the event that you're going to do for us on January 27th at our facility here in Hollywood, Florida. If you'd like to be part of that event, you can give us a call. The numbers and the contacts and the IGs and the YouTube, everything will be in the descriptions down below. And I would like to say good night and see you soon, Ms. J, and good night to our audience.
Thank you for having me. Good night, everybody.
To the next time with Healthy Exchanges with Dr. G, where we're bringing information to the people, and the information is power to change your life and improve your health. See ya.